Hey everyone, it's Anastasia. Anastasia's Hump Day Happenings. National Dental Hygiene Month. Can we get a smile and a hug? Hug your dental hygienist today. Not in a creepy way, because we are helping you have a happy smile for a happy life. Yeah, it's kind of like the spin of happy wife, happy life. Both are true. And that being said, what the heck is a dental hygienist? Our legal scope of practice encompasses every single thing there has to do with health and wellness, not cleaning. In fact, I challenge you, hashtag cleaning, go ahead, go on, and hashtag health and wellness, and Wellness Wednesday. Here's a glimpse of what your dental hygienist can do in a legal scope of practice. First, it's a medical history, and that isn't just, hey, any changes in medical history, see this, what's going on, nothing, see ya. That's not it. It is in-depth questions. It's an interview. Health and wellness, let's do this. All right, so they should take your blood pressure. They should ask about your HbA1c's if you're a diabetic, whether you're type 1 or type 2. And we can also discuss the benefit of water fluoridation in your communities. This is a big deal. I just had an interview on this. We discussed medication oral side effects from depression, blood pressure, heart disease, stroke. There's so many side effects from medication, breast cancer treatment, cancer treatments. It's amazing. So we can go over stuff like that. We get to talk about sleep apnea, stress, and yes, we talk about sex. HPV related, because oral cancer and oral sex, it's a risk factor. In fact, Gardasil, we should be asking that question of parents who have teenagers and asking them, hey, have they had a series of Gardasil yet? It's really important because it protects them against HPV, a known risk factor for oral cancer. In fact, the FDA just released, I believe, something that's in the Gardasil family pertaining to HPV prevention for ages 45 and over. Boom! Did you know that? Have you had that conversation? This is really important because it could save your life. Other conversations are about vaping. We could have this with the parents and saying, hey, did you know that a lot of kids under the age of 18 are vaping? Here's the impact of nicotine on the brain. Here are some side effects that we will see in the mouth from it. Let's just have a discussion about it. We can discuss the side effects of cannabis. Yes, there's a lot of pros, but you must also know what you, personally, your body may be at risk for. We discuss from the time of pregnancy, conception, of how to have a healthy mom to a healthy baby. If your child is born premature, we're able to share with you, here are some things to look for, oral side effects that can happen or that are known to be expected if your child is born early. Now, this is what we can do as far as customizing care for autistic patients. Down syndrome, ADHD, if you've had a stroke, way different things that people don't think about. All right, so we can discuss whether your bite or your occlusion is right, whether you're grinding your teeth away. We can discuss nutrition. That Prosecco, it tastes so good, but oh, does it just ever erode the enamel away? Kind of the same way when you have morning sickness, vomiting, erosive, or bulimia. We can see that, the erosion of your enamel, the thinning of your enamel due to that acid, and we can help you with that. We customize which toothpaste, which toothbrush, and which in-between plaque removal method. It's not all about floss. In fact, some of you might be saying, what's the fuss? I'll tell you what the fuss is. Blood and pus. That's the fuss. Okay? That is not normal. That is not healthy. So, what do? We help you manage, if not prevent, chronic active bacterial infections. And what are those? That is tooth decay and that is gum disease. So those are related to a slew of health hazards that we help you manage, if not completely eradicate, let alone straightening your teeth, whitening your teeth, and finding the best mouth rinse and nutritional life plan for you. Now, many of us are on like the keto diet. There's so many other things. You could be on Weight Watchers. All of that is great, but know that it can help contribute to bad breath. We can have products for that. It's just having a conversation with you. It's about health and wellness. Happy smile, happy life. Just like happy life, happy life. We want you to use that smile to your advantage, to build your self-esteem, to have more intimacy, more approachability, enjoy more relationships with your friends, not be so contained in a box. Hygienists, our role as a profession, are not contained in a box. We have the ability to empower you on your health, and I hope to do that for you. I'm sure I've missed a ton, but this is a great start. You've got a question for me as to what the heck does your dental hygienist do? Ask it. Like this channel, subscribe. It really does matter, and I appreciate it. Join me every single week. And until next Wednesday, take what you learn and make a difference with it.